Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Patients on lithium carbonate for management of bipolar disorder should be subject to routine assessment of A, a complete blood count and basic metabolic panel, B, thyroid stimulating hormone and serum sodium, C, a comprehensive metabolic panel and an electrocardiogram, or D, liver function tests and an electroencephalogram. So it's a short question, but it's a really important point. Remember that a big part of your certification exam is about safety. It's assessing your ability to safely manage the patient. And while lithium is an extremely effective drug, an extremely powerful drug, and has a whole litany of good things about it, the trade-off is it can be a dangerous drug and it can cause some really, really dangerous adverse effects and even death. So safe monitoring of lithium is really an important point. You definitely want to be familiar with it when you take your boards, because I guarantee you that you will have at least one lithium safety question, if not others. So what's the best answer here? What should the patient who is on lithium have routine assessment of? And the best answer to the question is B, thyroid stimulating hormone and serum sodium. And, this is one of those questions where if you're not really sure, you would say to yourself, isn't it good to monitor all of these things? Isn't there some benefit to monitoring all of these? And, there may even be. But remember, a hugely important part of your certification exam is your ability to prioritize. You have to be able to prioritize among assessments and among interventions, because in patient care and clinical practice, there's very often more than one way to approach a scenario, and we have to be able to discriminate among those choices and choose the best answer of those provided. And here, hands down, the answer is B, primarily because of the serum sodium. Now, we could have other things here that are very important. You might be thinking, what about renal function? Isn't it really, really important to monitor renal function? Isn't it really, really important to monitor for pregnancy? Absolutely. All of those things are hugely important in the patient on lithium therapy. Remember, you have to pick the best answer of those provided. This is one of those things that it's a test-taking skill. And so very often, people, new grads, when you're taking your boards, the information, so much, but have difficulty prioritizing. And I could see someone looking at this going, wait a minute, where's the renal function test? Where's the pregnancy? Isn't that a big deal? Yes, they are. But of the answer choices provided here, B is the most important. So the CBC and the BMP, not so much. Does the BMP give us an assessment of renal function? Yes, it does. It doesn't give us the GFR, which is the best assessment of renal function in routine venipuncture, but it does give us an assessment of renal function. But a CBC really isn't important. Lithium, for all of the things that it can affect, it doesn't really have a huge impact on the complete blood count. So A, if you're just looking at them and trying to, consider each one on its own merit, A, not so much. Could the BMP help? Yes, but it's not great because the GFR is better and the CBC doesn't contribute much. So A is a very lukewarm option. Now, the TSH and the serum sodium, we do know are both important. The TSH is important because we know that lithium is an iodine-containing drug and it suppresses thyroid synthesis of thyroid hormone. If you need a whole lot more discussion about that, I will refer you back to Chapter 2 of our review program. But for right now, I ask you to trust me that iodine does suppress thyroid hormone synthesis, and so we do need to routinely monitor patients on lithium for TSH. And if the TSH climbs above 4, we just put them on thyroid hormone irrespective of signs or symptoms. And of course, serum sodium is enormously important because sodium and lithium exist in opposites. I mean, they are, oh gosh, what's the word? They are inversely proportionate. So if the patient's serum sodium starts to drop for any reason, they will retain more lithium. And remember, lithium's therapeutic window, there's a real narrow space between minimally effective concentration and the minimally toxic concentration. So it's very, very easy to become lithium toxic if something else changes in that electrolyte balance. So medications that actually contribute to the excretion of sodium, things like ACE inhibitors and ARBs and diuretics for that matter, can concentrate lithium and precipitate toxicity. So B is certainly better than A. C, the comprehensive metabolic panel and the 12-lead ECG. Can lithium cause cardiotoxicity? It can. And does the CMP give you a BUN and creatinine? They do. But again, they're not nearly as compelling as B. And liver function tests and an EEG, again, the liver function tests, although they are important for so many psychotropic medications, not so much so for lithium because lithium is excreted unmetabolized by the renals. Renal function is much more important than liver function with lithium. And can lithium cause neurological toxicity? Yes, but you're going to know it hopefully long before there's any EEG changes. So when you look at these answer choices, again, I know I say this all the time because it's so important. Look at the question, look at exactly what it's asking you, and then pick the best answer of those provided. And if the answer you want isn't there, well, then you have to live without it. And if you think, wow, there's something to be said for all of these, that may be true. Come back to the one that's most compelling from a safety perspective.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.